the general said, okay, why don't we send this Mexican doctor from the army to treat patients to the ward of infectious diseases. And at that ward in the naval hospitals, the soldiers that were there were patients in acute distress, but the disease that my grandfather started to treat was malaria. Malaria in that year and those years and until many more years after, malaria is a disease that it's imported. That means you go to a specific area in the world, are bitten by the mosquito injects the agent, and you develop the disease. In some cases, it would be fatal because it is an infection. So my grandfather started to treat 10 soldiers in that ward in the San Diego Naval Hospital in the year of 1944. One of the family members of one of the soldiers at that time was working as a reporter in a magazine. The name of that magazine is Time Magazine. So the journalist went and see what was this Mexican doctor doing, and he reported in April 10 of 1944 in that magazine. He made a report of the incredible results of the patients treated for malaria. With one or two treatments, the patients were recovered. So it was kind of an amazing thing to see that with this treatment that the doctor was administering, the patients recovered and they did not have any side effects, nothing happened. But only one patient refused to follow all the indications of the treatment that my grandfather was given. So since 1944, malaria can be successfully treated. It's a disease, it's an infectious disease that can be successfully treated. As with many other infectious diseases, what IPT or insulin potentiation therapy does is shortens the time of the disease. Thus, if you are going to be ill for 5 or 7 days, if you are only ill for 2 or 3 days, that's a good result of the disease. So it is very effective to have this procedure.